This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, April 21st, and I'm Zach Caruso. Our lead story this week is in Nature and is titled A µ-opioid receptor superagonist analgesic with minimal adverse effects. This study identifies a novel µ-opioid receptor or MOR agonist with supramaximal intrinsic efficacy and a unique pharmacological profile that produced effective analgesia in rodents with minimal adverse effects. N-desethyl-fluornitrazene or DFNZ was derived from a class of synthetic benzimidazole opioids called nitazenes. DFNZ has impaired brain penetrance, a unique spatiotemporal MOR cellular signaling profile, and diminished efficacy at the MOR galanin 1 receptor heteromer. DFNZ does not induce respiratory depression, tolerance, or MOR downregulation after repeated exposure. Compared with other MOR agonists, DFNZ has limited effects on dopamine neurotransmission in the nucleus accumbens and weaker reinforcing effects in the drug self-administration procedure. These results provide novel insights about MOR and nitazene pharmacology, have important implications for pain and addiction treatment, and challenge the prevailing dogma that high-efficacy MOR agonists cannot constitute safe and effective therapeutic agents. Next is an article in the Journal of Studies on Alcohol and Drugs and is titled E-cigarette Use Trajectories and Respiratory Symptoms in Adolescents and Young Adults, Sustained Use Linked to Greater Symptom Frequency. Researchers conducted a cross-sequential study to examine any association between e-cigarette use patterns over 1 year and self-reported respiratory symptoms among adolescents and young adults 15 to 24 years old. In adjusted logistic regression analysis, there was no statistically significant associations between e-cigarette use patterns and dichotomous respiratory outcomes. In adjusted linear regression analysis, sustained and non-escalating use were associated with higher average days of symptoms. Sustained use was also associated with higher ATS-Q scores. Authors noted the data demonstrate dynamic e-cigarette use patterns and frequent use of multiple products, suggesting intervention approaches may need to be individualized. Our next article is in the Journal of Psychiatry and Neuroscience and is titled Machine Learning-Based Computational Validation of the Addictions Neuroclinical Assessment Framework in Relation to Hazardous Drinking. Diagnostic frameworks often focus on symptomatic presentations and not underlying psychological and neurobiological mechanisms of SUD. The Addictions Neuroclinical Assessment, or ANA, framework uses 3 domains as an approach to describing the underpinnings of SUD. Researchers conducted machine learning-based computation validation to assess any association between ANA domains and hazardous drinking measured by the Alcohol Use Disorder Identification Test. In 2 separate samples, researchers found a strong correlation between incentive salience and hazardous drinking. The authors note that while machine learning is unlikely to be used for clinical screening, these approaches could be used to help inform and refine other assessment tools. Our next article is in Drug and Alcohol Dependence and is titled Daily Motivation for and Perceived Accessibility of Non-Drug Reward Among People in Long-Term Recovery from Opioid Use Disorder. Neuroimaging studies show that persons with SUD have reduced response to pleasurable experiences, and OUD is associated with anhedonia. This study recruited 153 patients receiving MOUD from an outpatient treatment center. Each completed an anhedonia rating scale and then received a daily smartphone prompt to complete an inventory of the day's non-drug rewards. Of 1,700 person days recorded, the most common day had 1 to 2 non-drug rewards, with the most common reward being relaxing at home, followed by hobbies. The number of non-drug rewards was greater in people with higher motivation to pursue rewards and greater accessibility to rewards. Time in recovery and anhedonia were not significant predictors. The mean time in recovery was 3.8 years, and the authors speculate that improvements may have occurred earlier in recovery. Next is an article in JAMA Health Forum and is titled Private Equity Acquired Residential Treatment Facilities versus Other For-Profit Facilities. This study compared residential SUD treatment facilities owned by private equity with other for-profit facilities. Researchers conducted a secret shopper survey in which callers asked about costs and other facility details. Private equity facility daily rates were 16% higher and were less likely to offer detox services and private rooms. There was no statistically significant difference in bed availability or acceptance of Medicaid. The authors conclude that private equity ownership is associated with higher costs and call for studies of patient outcomes and quality of care. Our next article is in Nature Medicine and is titled An International Mega-Analysis of Psychedelic Drug Effects on Brain Circuit Function. 5 psychedelic drugs have a strikingly similar effect on brain networks. This mega-analysis integrated 11 independent resting state functional magnetic resonance imaging datasets across 5 psychedelic drugs from research groups spanning 3 continents and 5 countries. Several common features in the induced alterations to brain function were found across drugs and sites. Most prominently, researchers identified a core signature of increased functional connectivity between transmodal and unimodal networks with subnetwork specificity. Furthermore, key subcortical regions and the cerebellum exhibited altered coupling with the sensory motor networks. Next is an article in JAMA Open titled Point-of-Care Hepatitis C Testing in a Tribal Setting. This is a quality improvement study that integrated point-of-care hepatitis C virus, or HCV, RNA testing into a community-based harm reduction program serving the Cherokee Nation Reservation in northeastern Oklahoma from October 2024 to May 2025. The mixed method study collected data from paper-based surveys, electronic medical records, and qualitative data from staff meetings. 400 people participated in the study, with about 1/5 experiencing unstable housing and 2/5 with a history of injection drug use. A total of 405 tests were offered, with 348 individuals accepting testing. Due to insufficient sample volume, 16% of tests yielded invalid results. Of the remaining tests, 10% were positive for HCV RNA. As the study was offered within the Cherokee Nation Health Services, or CNHS, only American Indian and Alaska Native participants were able to be treated directly through the program, with the other participants referred to a non-tribal facility. Of the 12 individuals eligible for treatment at CNHS, 75% began treatment, with 67% initiating treatment on the same day of their evaluation. Of the 14 individuals referred to non-tribal facilities, none were reported to have initiated treatment, highlighting the importance of same-day integrated care. Our final article is in Addiction Science and Clinical Practice and is titled A Lifeline on Wheels: Perspectives of Stakeholders on the Implementation and Impact of a Mobile Medications for Opioid Use Disorder Unit. This qualitative study explored stakeholders' perspectives of a mobile health unit, or MHU, providing medications for opioid use disorder in Rhode Island. Semi-structured interviews were conducted with 15 participants, including MHU staff, leadership, policymakers, and community partners. Participants found the MHU decreased barriers to care, particularly for people experiencing homelessness, facilitated strong patient-provider relationships, and allowed for linkages to primary care and other social services. Funding sustainability, staffing shortages, and environmental barriers were key challenges faced by the MHU. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.